Hello, viewer.
Hello, viewer. Yeah, once again, welcome to Health Issues with Dr. P.E. Info. In this particular episode, we are going to continue our discussion on our prostate cancer series by looking at the topic investigating a patient with prostate cancer or a patient that is suspected to have prostate cancer. So when we talk about investigating, we're talking about the laboratory investigations or laboratory tests that are necessary for a patient with prostate cancer or a patient that is suspected to have prostate cancer. The first investigation is the prostate-specific antigen, which we talked about in our previous episode. So if the prostate-specific antigen is high, what is the next thing to do? The next thing to do is to go ahead and prepare for and then finally do a biopsy. The biopsy now confirms that there's prostate cancer. The next investigation that is done is called MRI, magnetic resonance imaging, to help us determine the stage. Of course, the biopsy, the tissues that were taken from the prostate for a test, the biopsy, is usually subjected to histology. So when the histology results comes out, there's what we call Gleason score. Gleason score can be Gleason score 6/10, 7/10, 8/10, 9/10, or 10/10. So the higher the Gleason score, the more aggressive prostate cancer most likely will tend to be. And that will also help us in advising you on how fast you need to, or how aggressive you also need to be in pursuing your treatment of the prostate cancer. That Gleason score is, if you find out it's prostate cancer, the next thing is the staging. Prostate cancer actually should not be treated just like that without staging, unless it is very, very obvious that this person has stage 4 prostate cancer by virtue of certain clinical features. But histological diagnosis is actually the ultimate, tissue diagnosis is actually the ultimate diagnosis. You don't say by virtue of symptoms or by virtue of PSA being higher, you label somebody as having prostate cancer. Because even some of the symptoms that you see in certain patients that might be looking like prostate cancer might not be it. So it's good to obtain a histological diagnosis, a tissue diagnosis, taking those tissues, viewing them under the microscope. So here is prostate cancer now. Staging is very important. Magnetic resonance imaging helps us to know whether the prostate cancer has gone beyond the prostate or not. Then other things like bone scan as needed, the PSMA PET scan as needed can come in. Beyond that, once these investigations are done and the stage of the prostate cancer then is determined, then you can now go ahead and talk about the treatment options that the patient is going to have. And some of these treatment options are also tailored based on the age of the patient, whether there are comorbidities. Of course, if somebody has hypertension, diabetes that is already weighing the person down, the treatment options we might want to offer might not be the same as somebody that is very, very healthy, strong and sound, just that the person has prostate cancer. So we do some other investigations, do the ECG, do the echocardiogram, try to ascertain fitness of the patient, look at other clinical parameters. These are the things that guides us into saying, okay, this is actually the best thing to do for you. So those investigations, ancillary investigations, what I mean by ancillary investigations, other investigations outside the main investigation are also very, very important to help us guide what you're going to do for you. So these investigations are all very, very important. And it's not the ancillary investigations like things like checking the sugar level, things like checking the blood level. It varies from patient to patient. Because even in late prostate cancer, when prostate cancer has gone into the bones, we discover that many of the patients will start having their blood level drop. And then the prostate that is already cancerous can also on its own bleed. So some of these things can lead to a drop in the blood level of the patient. So in a nutshell, these are some of the investigations that are necessary in a patient with prostate cancer. And yes, we've talked about these investigations, but also note that for early prostate cancer, there's curative procedures for early prostate cancer. I've talked about this in some episodes. Keyhole surgery for prostate cancer is available to us. Open surgery for prostate cancer is available with us. For the keyhole surgery, just 2 tiny holes, we go ahead and remove the prostate, the covering of the prostate, the seminal vesicles for early prostate cancer. So for people that have prostate cancer, there's hope. But the most important thing is to have these things detected on time. Thank you very, very much for watching this episode. Go ahead and share it to continue our discussion on prostate cancer in the next episode. Thank you.
Dr. Paul Ngwu is a urologic surgeon who is passionate about sharing his rich knowledge to improve your understanding of medical procedures and optimal health. With years of experience from intricate laser surgery techniques to essential endoscopic procedures, prostate health guidance, gynecological care, men's health, and etc., Dr. Paul's YouTube channel covers a vast range of medical enlightenment. By watching our tutorials, you'll gain in-depth understanding of medical procedures, insights into the latest technologies and techniques in use, confidence in your healthcare decisions, access to expert advice from a trusted specialist. Enhance your knowledge today by subscribing to this YouTube channel, Dr. P.E. Ngwu. Hit the subscribe button now. Join our community of healthcare professionals and individuals to learn more. Be accurate with the latest in medical knowledge. Click the notification bell to stay updated on our new tutorials, as page access is completely free. Dr. Paul Ngwu, empowering your medical knowledge one tutorial at a time.